Generalized anxiety disorder. Generalized anxiety disorder is a common disorder characterized by long-lasting anxiety which is not focused on any one object or situation. Those suffering from generalized anxiety disorder experience non-specific persistent fear and worry and become overly concerned with everyday matters. Generalized anxiety disorder is characterized by chronic excessive worry accompanied by 3 or more of the following symptoms: restlessness, fatigue, concentration problems, irritability, muscle tension, and sleep disturbance. Generalized anxiety disorder is the most common anxiety disorder to affect older adults. Anxiety can be a symptom of a medical or substance abuse problem, and medical professionals must be aware of this. A diagnosis of GAD is made when a person has been excessively worried about an everyday problem for 6 months or more. These stresses can include family life, work, social life, or their own health. A person may find that they have problems making daily decisions and remembering commitments as a result of lack of concentration or preoccupation with worry. Appearance looks strained with increased sweating from the hands, feet, and axillae, and they may be tearful, which can suggest depression. Before a diagnosis of anxiety disorder is made, physicians must rule out drug-induced anxiety and other medical causes. In children, GAD may be associated with headaches, restlessness, abdominal pain, and heart palpitations. Typically, it begins around 8 to 9 years of age. Specific phobias. The single largest category of anxiety disorders is that of specific phobias, which includes all cases in which fear and anxiety are triggered by a specific stimulus or situation. Between 5% and 12% of the population worldwide suffer from specific phobias. According to National Institute of Mental Health, a phobia is an intense fear of or aversion to specific objects or situations. Sufferers typically anticipate terrifying consequences from encountering the object of their fear, which can be anything from an animal to a location to a bodily fluid to a particular situation. Common phobias are flying, blood, water, highway driving, and tunnels. When people are exposed to their phobia, they may experience trembling, shortness of breath, and rapid heartbeat. Thus, meaning that people with specific phobias often go out their way to avoid encountering their phobia. People understand that their fear is not proportional to the actual potential danger but still are overwhelmed by it. Panic disorder. With panic disorder, a person has brief attacks of intense terror and apprehension, often marked by trembling, shaking, confusion, dizziness, nausea, and/or difficulty breathing. These panic attacks, defined by the APA as a fear or discomfort that abruptly arises and peaks in less than 10 minutes, can last for several hours. Attacks can be triggered by stress, irrational thoughts, general fear or fear of the unknown, or even exercise. However, sometimes the trigger is unclear and the attacks can arise without warning. To help prevent an attack, one can avoid the trigger. This can mean avoiding places, people, types of behaviors, or certain situations that have been known to cause a panic attack. This being said, not all attacks can be prevented. In addition to recurrent unexpected panic attacks, a diagnosis of panic disorder requires that said attacks have chronic consequences. Either worry over the attack's potential implications, persistent fear of future attacks, or significant changes in behavior related to the attacks. As such, those suffering from panic disorder experience symptoms even outside specific panic episodes. Often normal changes in heartbeat are noticed by a panic sufferer, leading them to think something is wrong with their heart, or they are about to have another panic attack. In some cases, a heightened awareness of body functioning occurs during panic attacks, wherein any perceived psychological changes is interpreted as a possible life-threatening illness. Agoraphobia. Agoraphobia is the specific anxiety about being in a place or situation where escape is difficult or embarrassing, or where help may be unavailable. Agoraphobia is strongly linked with panic disorder and is often precipitated by the fear of having a panic attack. A common manifestation involves needing to be in a constant view of a door or the escape route. In addition to the fears themselves, the term agoraphobia is often used to refer to avoidance behaviors that sufferers often develop. For example, following a panic attack while driving, someone suffering from agoraphobia may develop anxiety over driving and will therefore avoid driving. This avoidance behavior can often have serious consequences and often reinforce the fear that they are caused by. In a severe case of someone with agoraphobia, they may never leave their home. Social anxiety disorder. Social anxiety disorder, also known as social phobia, describes an intense fear and avoidance of negative public scrutiny, public embarrassment, humiliation, or social interaction. This fear can be specific to particular social situations such as public speaking, or more typically, it is experienced in most social interactions. Roughly 7% of adults have social anxiety disorder, and more than 75% of people experience their first symptoms in their childhood or early teenage years. Social anxiety often manifests specific physical symptoms including blushing, sweating, rapid heart rate, and difficulty speaking. As with all phobic disorders, those suffering from social anxiety often will attempt to avoid the source of their anxiety. In the case of social anxiety, this is particularly problematic, and in severe cases can lead to complete social isolation. It is important to understand that children also affected by social anxiety disorder while attending school, although their symptoms associated with this disorder are different compared to the teenagers and adults. Their symptoms can include difficult processing or retrieving information, sleep deprivation, disruptive behavior in class, and irregular class participations. Posttraumatic stress disorder. Post-traumatic stress disorder was once an anxiety disorder that results from a traumatic experience. PTSD affects approximately 3.5 of adults every year, and an estimated 1 in 11 people will be diagnosed with PTSD in their lifetime. Post-traumatic stress can result from an extreme situations such as combat, natural disaster, rape, hostage situations, child abuse, bullying, or even a serious accident. It can also result from long-term exposure to a severe stressor. For example, soldiers who endure individual battles cannot cope with continuous combat. Common symptoms include hypervigilance, flashbacks, avoidant behaviors, anxiety, anger, and depression. In addition, individuals may experience sleep disturbances. People who suffer from PTSD often try to detach themselves from their friends and family and have difficulty maintaining these close relationships. There are numbers of treatments that form the basis of the care plan for those suffering with PTSD. Such treatments include cognitive behavioral therapy, prolonged exposure therapy, stress inoculation therapy, medication, and psychotherapy and support from family and friends. Separation anxiety disorder. Separation anxiety disorder is the feeling of excessive and inappropriate levels of anxiety over being separated from a person or place. Separation anxiety is a normal part of development in babies or children, and it is only when this feeling is excessive or inappropriate that it can be considered a disorder. Separation anxiety disorder affects roughly 7% of adults and 4% of children, but the childhood cases tend to be more severe. In some instances, even a brief separation can produce panic. Treating a child earlier may prevent problems. This may include training the parents and family on how to handle with it. Often, the parents will reinforce the anxiety because they do not know how to apply or properly work through it with the child. In addition to parent training and family therapy, medication such as SSRIs can be used to treat separation anxiety. Situational anxiety. Situational anxiety is caused by new situations or changing events that can also be caused by various events that make the particular individual uncomfortable. Its occurrence is very common. Often, an individual will experience panic attacks or extreme anxiety in specific situations. A situation that causes one individual to experience anxiety may not affect another individual at all. For example, some people become uneasy in crowds or tight spaces, so standing in a tightly packed line, say at the bank or at the store register, may cause them to experience extreme anxiety or possibly a panic attack. Others, however, may experience anxiety when major changes in life occur, such as entering college, getting married, having children, etc. Obsessive-compulsive disorder. Obsessive-compulsive disorder is not classified as an anxiety disorder by the DSM-5 but is by the ICD-10. It was previously classified as an anxiety disorder in the DSM-4. It is a condition where the person has obsessions like distressing, persistent, or intrusive thoughts or images, and compulsions such as urges to repeatedly perform specific acts or rituals that are not caused by drugs or physical disorder and by which cause distress or social dysfunction. The compulsive rituals are personal rules followed to relieve the feeling of discomfort. A person with OCD knows that the symptoms are unreasonable and struggles against both the thoughts and the behavior. Their symptoms could be related to external events they fear, such as their home burning down because they forgot to turn off the stove, or worry that they will have behaved inappropriately. It is not certain why some people have OCD, but behavioral, cognitive, genetic, and neurobiological factors may be involved. Risk factors include family history, being single, and higher socioeconomic class or not being in paid employment. Of those with OCD, about 20% of people will overcome it, and symptoms will at least reduce over time for most people. Selective mutism. Selective mutism is a disorder in which a person who is normally capable of speech does not speak in specific situations or to specific people. Selective mutism usually coexists with shyness or social anxiety. People with selective mutism stay silent even when the consequences of their silence include shame, social ostracism, or even punishment. Selective mutism affects about 0.8% of people at the same point of their life. Testing for selective mutism is important because doctors must determine if it is an issue associated with a child's hearing, movements associated with the jaw or tongue, and if the child can understand when others are speaking to them. Drugs. Anxiety and depression can be caused by alcohol abuse, which in most cases improves with prolonged abstinence. Even moderate, sustained alcohol use may increase anxiety levels in some individuals. Caffeine, alcohol, and benzodiazepine dependence can worsen or cause anxiety and panic attacks. Anxiety commonly occurs during the acute withdrawal phase of alcohol and can persist for up to 2 years as part of post-acute withdrawal syndrome in about a quarter of people recovering from alcoholism. In these patients, An initial increase of anxiety occurred during the withdrawal period, followed by a cessation of their anxiety symptoms. There is evidence that chronic exposure to organic solvents in the work environment can be associated with anxiety disorders. Painting, varnishing, and carpet laying are some of the jobs in which significant exposure to organic solvents may occur. Taking caffeine may cause or worsen anxiety disorders, including panic disorder. Those with anxiety disorders can have high caffeine sensitivity. Caffeine-induced anxiety disorder is a subclass of DSM-5 diagnosis of substance or medication-induced anxiety disorder. Substance or medication-induced anxiety disorder falls under the category of anxiety disorders and not the category of substance-related and addictive disorders, even though the symptoms are due to the effects of a substance. Medical conditions. Occasionally, an anxiety disorder may be a side effect of an underlying endocrine disease that causes nervous systems to hyperactivate, such as pheochromatosoma or hyperthyroidism. They have also been known to be associated with certain respiratory disorders like chronic obstructive pulmonary disease or COPD. Stress. Anxiety disorders can arise in a response to life stresses such as financial worries, chronic physical illness, social interaction, ethnicity, and body image, particularly among young adults. Anxiety and mental stress in midlife are risk factors for dementia or cardiovascular diseases during aging. A large amount of stress can be related to any pandemics or epidemics that are occurring in the world. For example, in 2019, the coronavirus disease or COVID-19 pandemic was very stressful for those who already suffered from an underlying medicational condition. Genetics. GAD runs in families and is 6 times more common in the children of having someone with the condition of it. A study comparing families and twins to determine the possibility of children having an anxiety disorder revealed that there is a genetic heritability of 31.6% given the twins have the same predisposing genes across sexes. While anxiety arose as adoption, in modern times, it is almost always thought of negatively in the context of anxiety disorders. People with these disorders have highly sensitive systems. Hence, their systems tend to overreact to seemingly harmless stimuli, and sometimes anxiety disorders occur in those who have had traumatic youths, demonstrating an increased prevalence of anxiety when it appears as a child will have a difficult future. In these cases, the disorder arises as a way to predict that the individual's environment will continue to pose threats. Persistence of anxiety. At a low level, anxiety is not a bad thing. In fact, the hormonal response to anxiety has evolved as a benefit as it helps humans react to dangers. Researchers in evolutionary medicine believe that this adaptation allows humans to realize that there is a potential threat and to act accordingly in order to ensure greatest possibility of protection. It has actually been shown that those with low levels of anxiety have a greater risk of death than those with average levels. This is because the absence of fear can lead to injury or death. Additionally, patients with both anxiety and depression were found to have lower morbidity than those with depression alone. The functional significance of the symptoms associated with anxiety includes greater alertness, quicker preparation for action, and reduced probability of missing threats. In the wild, vulnerable individuals, for example those who are hurt or pregnant, have a lower threshold for anxiety response, making them more alert, and this demonstrates a lengthy evolutionary history of anxiety response. Prevention. Focus is increasing on prevention of anxiety disorders. There is a quantitative evidence to support the use of cognitive behavioral therapy and mindfulness therapy. A 2013 review that found no effective measures to prevent GAD in adults. A 2017 review found that physiological and educational interventions had a small benefit for the prevention of anxiety. Lifestyle and diet. Lifestyle changes include exercise, for which is moderate evidence for some improvement, regularizing sleep patterns, reducing caffeine intake, and stopping smoking. Stopping smoking has benefits in anxiety as larger than those of medications. Therapy. Cognitive behavioral therapy is effective for anxiety disorder and it is a first-line treatment. CBT appears to be equally effective when carried out via the internet. While the evidence for mental health apps is promising, it is preliminary. Self-help books can contribute to the treatment of people with anxiety disorders. Mindfulness-based programs also appear to be effective for managing anxiety disorders. It is unclear if meditation has an effect on anxiety, and transcendental meditation appears to be no different than other types of meditation. Medications. Medications include SSRIs or SNRIs are first-line choices for generalized anxiety disorder. There is no good evidence for any member of the class being better than another, so cost often drives drug choice. If they are effective, it is recommended that they may be continued for at least a year. Stopping these medications result in a greater risk of relapse. Medications need to be used with care among other adults who are more likely to have side effects because of coexistence physical disorders. Adherence problems are more likely among older people who may have the difficulty understanding, seeing, or remembering instructions. In general, medications are not seen as helpful in specific phobia, but in benzodiazepine is sometimes used to help resolve acute episodes.